871 in Medic 6. You're seeing a 74-year-old male, shortness of breath.
Incidents involving electrical injuries, although relatively uncommon, demand careful scene size-up, patient assessment, and critical thinking on the part of the EMS provider. Some incidents involve obvious electrical hazards that may cause electrical injuries. However, it may not always be apparent that an injury was caused by electricity or that an electrical hazard is nearby. During scene size-up, providers must determine if any electrical hazards could be the cause of patient injuries. Electrical conduction injuries can present both medical and trauma problems. Injuries from electricity may not be visible and may not present symptoms right away. It is critical that EMS providers remain suspect of electrical injuries and conduct a thorough scene size-up to avoid electrical hazards.
Andy!
Whether outdoors, in a commercial setting, or in a household, incidents involving electricity pose extreme danger to first responders, victims, and bystanders.
Well, probably the first thing that I always consider involving electrical injuries is the safety of myself and my crew. As we all know, most of us are fairly afraid of electricity. It's a fairly dangerous situation, so trying to notice wires down, the type environment that we're in, whether we're in a wet environment, wires down across chain link fence that you may be approaching somebody's house, some kind of a construction accidents, fairly common. So scene safety is probably number one.
Responders can plan ahead for incidents involving downed power lines by establishing a response agreement with local power companies. Other incidents, such as those involving a lightning strike, may require an evacuation plan for responders. When initially dispatched to a call, ensure that there is appropriate equipment and resources to secure the scene and treat patients. If necessary, establish a safe zone and an incident safety officer upon arrival. Position a rescue vehicle at least one length away from any downed power lines and approach any scene with caution. Make sure that at least your secondary lights are flashing to warn incoming units and personnel.
Driver! Driver of the vehicle!
As always, follow standard precautions.
Do not attempt to exit the vehicle!
Oh wait, there's some wires.
During scene size-up, consider the conditions of the scene, the number of patients, and the need for additional resources.
Is the power still on?
Yes it is.
Can you be safety officer?
Yes.
And have the power shut off?
I'll show you where it is.
Treat any electrical source as though it is live. Appliances or electrical wires may appear to be dead, but could still have substantial electrical current. Ensure that the power source is turned off before approaching a patient. Never attempt to remove a patient from an electrical source unless trained to do so. If there are unsafe conditions at the scene, determine if you need to move the patient as part of securing the environment before beginning treatment.
Commander? Yep. The circuit is de-energized and grounded. Power lines off. Proceed into the scene.
While securing the scene may cause a delay in patient treatment, it is essential to protect the safety of the crew first and foremost. Electrical injuries can occur in various ways, such as contact with an electrical source, proximity to lightning, or an electrical arc, or stepping into an area with a ground current. These circumstances can result in a current passing through the body, heating tissue, and causing burns to the surface of the skin and to deeper tissues. Blunt trauma can also occur if a person is thrown away by an electrical shock. The type of circuit impacts the type and severity of electrical injury. In addition, the severity and type of any electrical injury is determined by the strength of the electrical current, the pathway that the current travels, and the length of time a person is exposed to the electrical source. There are two types of circuits: direct current, or DC, and alternating current, or AC. The type of current affects how the body responds to electrical shock and the duration of the contact.
If you look at an AC current versus DC current has a tendency to cause one quick muscle spasm, knocks the person away, and they'll get some sort of electrical injury, but there's also a good chance of trauma on top of it. However, in comparison to alternating current, or AC current, has a tendency to have multiple spasms, which requires or causes the victim to latch on, or muscle spasm causing them to hold on to the source. So we have a longer duration or longer contact with electricity.
An electrical current is expressed in amperes, which measure the amount of energy that flows through an object. 6 to 9 milliamps can cause muscular contraction or tetany, whereas 50 to 100 milliamps can result in respiratory arrest and ventricular fibrillation. Voltage measures the relative amount of energy that will be carried between 2 points and is determined by the electrical source. Higher voltage is associated with greater morbidity and mortality. The pathway that a current takes determines which tissue is at risk. Tissue in the body that has a high resistance to the flow of current is more likely to become damaged by electrical current.
Certain tissues and organs in the body, based on their density and their makeup, some of them will pass the electricity kind of straight through. Something like muscle or blood or blood vessels, even though they can be damaged, they have a tendency to allow the electricity to pass through. Where you might look at something like bone or even fat or tendons, have a tendency to slow the movement of the electricity, which causes the heat to build up even more, which causes more damage. Then you have a tissue like the skin is kind of in the middle. The skin is something that not only will slow it a little bit, that's why we get a lot of the burns of the skin, but it also allows the electricity to pass through into deeper areas.
The longer that a person is exposed to an electrical source, the greater the severity of injury. By understanding how electrical current affects the body, providers can gain insight into the types of injuries that can result from electricity.
I have a rapid pulse.
Assessing patients and determining injuries is one of the great challenges for emergency medical providers arriving at a scene involving an electrical source.
I have an entrance wound on his right hand.
Every organ system can be affected, but the ones we most worry about is a neurological damage and cardiac arrest or cardiac dysrhythmias. We can also have a strong enough spasm across the chest that can actually stop a person from breathing. And when they stop breathing, obviously patients become hypoxic, they have lack of oxygen. That could lead to cardiac arrest, that could lead to more neurological or brain injuries on top of it. So we're talking about a whole body event as compared to some things that may be just more specific areas.
The most common point of contact for high voltage injuries is the head. Electrical current passing through the head can cause burns, neurologic damage, cataracts, or skull fractures. Current passing through the brain can cause respiratory arrest, seizures, and paralysis. Incidents involving an electrical source can result in cardiac injury such as asystole or ventricular fibrillation, or other dysrhythmias like sinus tachycardia, premature ventricular contractions, atrial fibrillation, and bundle branch block.
The most common one that people hear about is the cardiac arrest, and of course that's the one that gets most people's attention. But there's quite a variety of injuries that can occur, and in fact that makes it more confusing for paramedics and EMTs and even physicians to assess these patients. For example, these people can have a cardiac problem. Doesn't mean they went into cardiac arrest, but there can be heart damage where they're going to get death and arrhythmias.
Injuries to the skin, such as burns on the hands, skull, or heel of the foot, are common electrical injuries. These can include linear burns, which tend to occur in areas where sweat or water accumulates, regular thermal burns, or punctuate burns.
No exit wound on the feet.
And then if you add on top of that somebody who gets knocked a certain distance, they fall a certain distance, now we add in trauma. You know, everything from head injuries, spinal cord injuries, extremity fractures.
Blunt trauma related to an electrical shock can cause fractures, dislocations, or cervical spine injuries. Vascular injury is less common, although muscle edema can occur when blood flow is obstructed. In cases where the victim has suffered a fall or blunt force trauma from an electrical shock, responders can apply spinal motion restriction prior to movement or splint fractures and dislocations.
Andy, I'm Janelle.
A patient who has received an electrical shock may present with confusion or short-term memory loss. Seizures and other neurologic symptoms can occur, often with long-term effects.
You have any pain here? Okay, you got hold of the head? All right. Any pain in the back here? Any pain in there?
It is essential to conduct a thorough assessment of the patient, asking the question, what type of injuries could this person have? Burns, head injury, neck injury, broken extremities, and heart problems are only some of the effects of electrical injuries that may occur. Emergency medical providers who are familiar with the types of electrical injuries can help to improve positive outcomes with appropriate treatment and rapid transport to a hospital. Begin by initiating standard basic life support and advanced life support measures. Electrical injury patients may require a combination of cardiac and trauma care. This requires a two-pronged approach to treatment. Following an electrical shock, cardiac muscle tissue may pause activity. In some cases, the muscle tissue can resume activity automatically, but respiratory arrest could lead to ventricular fibrillation from hypoxia, a lack of oxygen in reaching the tissues.
Now we're also talking about burn patients. How do we treat normal burn patients? And I recommend everybody follow their own local protocols, but generally we're talking about clean, dry dressings. We need to consider taking these people possibly to trauma centers, maybe burn units, but again, follow your local protocol and what's appropriate for your own location to do that. So everything that you can find as far as how I would treat a stroke, how I might treat a patient with a heart problem, how I might treat somebody who's burned, how I might treat somebody who has a seizure, all of those protocols could come into play. So it's almost the whole book, you know, is looking at everything that I may have learned through schooling and experience could come into play on that patient. So I don't rule anything out.
All electrical injury patients should be transported to the hospital for assessment by a physician, as the degree of internal injury cannot be assessed in the field.
Look at the big picture. What kind of patient are we talking here? We're talking medical patient with a combination trauma patient. It's that two-pronged approach. When I finally get to the patient, nothing's off the table. I'm looking for everything. That's talking immobilization. We're looking at cardiac. We're looking at blood pressure problems. We're looking for strokes. Any kind of trauma injury. These folks need to be transported. Obviously, you may have to go through some sort of medical direction to maybe try to convince somebody to go to the hospital because, again, you know, we live in the United States and people have an opportunity to refuse. But it's really incumbent upon the rescuers to try to make sure that these folks are seen at the hospital, seen by a physician, so that we have the most optimum outcome that we can.
Patients may not show signs or symptoms immediately, so evaluation at an appropriate hospital is of the utmost importance. By developing an awareness of injuries that may be hidden and practicing proper seeing size up, EMS providers can help to ensure the highest quality of care for patients with electrical injuries.